All right, welcome everyone to the November PFA Network monthly coffee chat. I can't believe that we're creeping up to the end of November and that Thanksgiving is next week. That was a surprise to almost everybody that I've talked to that Thanksgiving is next week. But I hope you are all looking forward to all of the holidays you have coming up. I'm going to turn on the captions if anyone needs it as well. If you are new to the coffee chats, first of all, welcome. Typically, Laura Jackson, who is the Director of Community, facilitates these coffee chats. But as I mentioned, she's in an all-day meeting today, so you are with me. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. So I deliver a lot of our skills exchanges for the PFA network, those skills development opportunities for patients, family caregivers, and everyone serving the role as patient family partner, advisor, whatever you would like to call yourselves. Today's coffee chat is in honor of National Family Caregivers Month. But it is also National Native American Heritage Month. Or Indigenous Peoples Month. So would love to bring in that piece of the conversation as well and just honor both of those observances today. As far as family caregiving goes, I have my own experience. I'm not personally a family caregiver, but I grew up with a sister who had cerebral palsy. So I saw my parents really advocate for her. You know, she was in a wheelchair. She couldn't eat, couldn't speak, couldn't walk. And so they really had to be her kind of full-time advocates and family caregivers. And so I just have so much appreciation for my parents and all of you family caregivers out there. It's not an easy job. So just want to recognize that. And this month, the theme for National Family Caregivers Month is, I believe it's connecting caregivers. So I'm really grateful for the opportunity to be able to connect with all of you and bring everyone together for this conversation today. All right, so just some logistical stuff. We're recording. I just turned on the live transcript. Here's some Zoom information. Excuse me. If you need it, but I think we're all quite familiar with Zoom in right now. If you need to chat me personally for anything, you can do that by just clicking on me individually in the chat box. And please use the raise hand or reactions if you like what someone says, if you love what someone says, or if you would like to come off mute and ask a question or speak up, you can. There's also a raise hand button there. And then we have turned on the live transcript for anyone who needs it. All right, and then to just level set and get us all started on the same page for our discussion today, we have some agreements that we like to do at the front of any session like this or listening session. I won't go through all of them, but I'll leave them up there for a moment so you can all take a look. I think the most important one that I really like is that stories stay and lessons leave. So while we are recording for note-taking purposes, we will never share your own personal stories unless we have your permission, but we do want to take all the lessons that are there within your own stories. All right. So looks like we have a small enough group so we can go around and do some quick introductions. So your name, your location, and then in honor of the holidays coming up, what are you grateful for today? So I'll go first. I did introduce myself. I'm Lindsay Galley. I'm located in Sacramento, California, so up north. And today, like I said, I'm just grateful for the opportunity to bring family caregivers together for this conversation today. And for my parents, like I said, and all of their hard work. So that is what I'm grateful for. All right, let me go through my list here. And Linda, you're right at the top.
Okay, that makes it easy.
Yeah.
So I'm Linda Starnes, and I'm in the Orlando, Florida area. and I've been in the business of caregiving one way or another for decades. And I am grateful today that I have been honored to be a family caregiver. And my daughter, who now works in the field of disability and public health, is on with us, Emily. And then my son, who still lives at home with us, but is doing great too. It's been a wonderful ride as a parent. And I was grateful that my daughter and son-in-law were here for a week, and they just flew home on Wednesday. So we had early celebration.
That's awesome. I didn't put that together at first, Linda. That's your daughter. That's amazing.
That's what I mean. The product of my caregiving is here.
Makes sense now. That's too funny. Well, we're really excited to have Linda here. We'll be having a discussion with Linda more about her family caregiving and just celebration of this month. So thank you, Linda. And naturally, we'll go to Emily next.
From one Starnes to another, from the East Coast to the West Coast. Hi, everybody. My name is Emily Bridges. I am the public health advocate at the Independent Living Resource Center, which is a center for independent living. And I'm located in our Ventura office today, but we also serve Santa Barbara and San Luis Obispo counties as well. And my pronouns are she and her. And what I am grateful for today, I think my mother actually covered as well. So just to summarize, grateful that we did have a week-long vacation, my husband and I, a pre-Thanksgiving in Orlando and the surrounding areas there, that we got back home safely, although a little bit jet lagged, and just also grateful that next week we get to spend some time with his family for the actual Thanksgiving.
Oh,
and I'm also thankful to be here as well.
awesome. Thanks so much, Emily. Appreciate you being here. Sal, welcome.
Yeah, good morning. My name is Sal Lopez. I live in South Lake Tahoe. I'm a member of the Patient Family Advisory Council for Barton Community Hospital. And I think what I'm grateful for is just getting involved with this group. It was a fluke through the council there at the hospital. Somebody, in fact, I asked one of the women, how did these people find out about me? Because I got this email from PFCC, whoever they are. And so I followed up, and it turns out that they gave my name because I kept talking about baby boomers, health, mental health. And so she sent my information down to you guys. And so I started going to your meetings. And when I went to Sacramento, even though the technology was bad, I couldn't really talk that much, so I couldn't hear. I shared my story in writing to Laura and sent it to her and said, yeah, share it to the world. I don't care, because I'm concerned about, there's a lot of us baby boomers going to impact the system tremendously. And my connection and my sharing was, seniors and mental health, and using the resources, Medicare and whoever your supplemental is, to seek therapy. Because a lot of these physical things that go on with people at our age really are not necessarily only physical. So
true, yeah.
anyway,
Well, thank you, Sal. We that's a very happy accident. We're happy to have you. Thank you. All right. How about Lori?
Hello, I'm Lori Albers. I am a project manager for family engagement through Children's Wisconsin in sunny Milwaukee. And I'm also a caregiver to two kiddos. I have one child, 14, who has a lot of complex needs. And then I have a daughter who's 12, who is having a lot of mental health struggles. So I kind of have my hand in a little bit of everything, and it ties really within what I do for our hospital as well. So it's a pleasure to be here. And what I'm grateful for is both of my kiddos, because I would not have the career I have today without having gone through so much with them. So it's a beautiful gift all the way around.
Absolutely. Thanks, Lori. Thanks for joining today. Dion, you're next on my list.
Good morning. I'm Dion Stalling. I'm the executive director and founder of a nonprofit called Rare and Black. I'm in St. Louis right now. And today I'm grateful for the people who donate plasma so I can be able to do the work that I do.
That's amazing. Thanks, Dion, for sharing. A lot to be grateful for.
Thank you.
All right. Emily Newberry. Other Emily here with us.
Hi, my name's Emily Newberry. I work for Kaiser Permanente Northwest region, bringing on board our members to serve as patient partners and helping us to improve the way we deliver care. I like to say my tagline is I help other people shine. And I am grateful for the PFA network because you bring forth such a wonderful diversity of voices that I learn from that helps me be better at my job in supporting our patient partners. So thank you.
Oh, nice. I like that a lot, Emily. That's what this is all about. Let's all learn together so we can improve all over the place, all over this world. Thanks, Emily. Naomi. Hi, friend.
Hi, happy Friday, everyone. I am Naomi Williams, joining you from what is known as Muskogee Land, now known as Augusta, Georgia. I am a colleague of Lindsay's and with PFCC Partners. I do patient family engagement. And I am grateful. I'm grateful for these targeted conversations. I too am a caregiver of an amazing 14-year-old, yay for teenage years, Joy, who is very medically complex. So I'm grateful to be in the room and part of the conversation today.
Awesome. Thanks, Naomi. Karen Fernandez.
Wait a minute. Good morning, everybody. I'm not camera ready, so you get my picture.
That's okay.
I'm calling from Dallas, Texas. I'm a patient. I've been a patient caregiver. I'm a patient advocate. I'm the administrator for DES, diethylstilbestrol Information Association. And what I'm grateful for, a couple things. I'm really grateful for the inclusion of patients and families and advocates and into what we're all doing today. And but I have another thing to be really grateful for, and this is why I'm not camera ready. I went down into the rabbit hole of genealogy this morning. That's a big genealogy, and I'm preparing my applications to join the Métis Nation of Canada with my Aboriginal ancestors.
Wow.
Yeah, you once you go down that rabbit hole, it's hard to get out, but I'm getting really close. So I've been accepted into one Métis Nation, and I'm applying for 2 more. So
interesting. Yeah. Well, thank you for sharing that, Karen. Yeah, I would love to learn more at another time. That's really great.
Thank you.
Awesome. Thanks, Karen. And I think last on the list is Michelle. Hi, Michelle.
Hi, good morning, everyone.
Hi. How are you?
I joined late, so I think it's what I'm grateful for, where I'm from.
Yeah.
I'm from Los Angeles. I'm a mother of 3, and I'm grateful. There's a million things to be grateful for, and I'll just leave it at that.
I like that. It's good to be grateful that there are things to be grateful for. Yeah, feeling very, very lucky and blessed to be with all of you today. Awesome. Well, did I miss anyone? I'm pretty sure I captured everybody. Yep. All right. Okay. So at the top of the hour, as I mentioned, this month is National Family Caregivers Month. So we wanted to take the time during this meeting to spend some time talking with Linda Starnes, and I'm hoping that also Trish Paquate joins. I know she was having some trouble joining, which is why I was checking my email. Who is also, she is part of Family Voices in New Mexico. So we'll invite both of them into the conversation. But there is so much information about National Family Caregivers Month out there. So we'll follow up with some more information. There's also some links on the PFAnetwork forum, which we can share the link to as well. But again, this year's theme is Caregivers Connect. So really emphasizing that importance for us all to connect and support each other, which is exactly what we wanted to do here. And then also November is National Native American Heritage Month. Again, there is so much information online about American Heritage Month. And Naomi, you reminded me when you acknowledged your tribal land that there is a link, and I'm going to put it in the chat, where you can put in your, I believe your forget like what exactly you have to put in. It might even be your zip code or your address, but you can identify the native land of where you live. So if everyone wants to take a minute to do that and type in your native land, would love to see, because we have so many people all over the country on today. So would love to see that as well. But yeah, so that's part of the reason why we were really excited to have Trish Paguate join. She is part of a tribe in New Mexico and has talked a lot about in another project that we're in with the New Mexico Hospital Association, some of the cultural aspects around Native American heritage and health. So hoping that she is able to join, but if not, we'll continue that conversation with her to learn more, because I believe that that's a group that is not as widely represented in the PFAnetwork, and we can definitely benefit from learning a lot more from. And thank you all for putting in your native lands, honoring your native lands today. All right. Okay, well, I wanted to kind of speed through that information and kind of level setting and introduction so we could spend most of our time today chatting. This is the coffee chat after all. So again, I would like to invite Linda in. I have a few questions set up for Linda, and then we'll open it up for you know, anyone who wants to jump into the conversation, ask questions, share your own experiences. You know, this is our time to connect. So Linda, I am curious about the role of family caregivers within your own specific community, whatever you consider community to be.
Well, for a long time, I was a parent at home, because and Emily and my adult son Mac have given me permission, due to the fact that we're kind of an open book family, to share about our family in kind of a public forum. But it's nice to have Emily here. She can she can always speak up for herself in the chat part. But both of my two kids were born with very rare and very different genetic conditions. And it was apparent from the moment they arrived in the in the delivery room that that they were coming with some special circumstances, and that our family was going to have a different journey than most families. So I stayed home to care for both of them. Emily's situation affected her much more so in her infancy through childhood years. As you can see, she's very accomplished. She's got a master's degree in public health and married and doing very well. Our son had even more medical complexities. He has lived life with a trach and a feeding tube, and he uses assistive technology for communications. So that kind of gives you an idea and flavor of our family, and the fact that why I was an instant family caregiver when they came along. But I think there, my community is that I think we all are caregivers at one point or another, or many of us find that we are in that situation, whether we are a child doing some caregiving with our adult and aging family members or friends who live across the street that need some help. You know, kin family situations, siblings you were mentioning. And Emily is a sibling caregiver. As she was growing up, she had to learn about her little brother and his care needs, and at times lent some support. And then, you know, we've got our foster families who are and adoptive families who are in that caregiving role too. So it's a big old community. There's a lot of us. And when you go to some of the national caregiving websites, you'll see that those statistics, and I know Lindsay, you all shared that too. So we are a big group and can bring a lot of voice to bear, but unfortunately we are somewhat unseen as well. I'm going to come back to that in a minute. So then as my kids grew up and I was able to move back into the workforce, my community now is that I serve with our state Department of Health. Like mother and daughter, I follow my daughter into public health work through a different door, but I'm the statewide family leader for our Title V program here, which delivers services to children and youth with special healthcare needs and their families. And so we work at the population health level to affect, we hope, the large population of families that have children and youth with special healthcare needs in Florida by some of the programmatic and policy work that we do. But that's my people. And so I'm so proud to be in community and hoping to help that community. And we believe in connection, a lot of connection. And that's why my program started the Florida Family Leaders Network. So that is a connection group for those of us who've moved beyond direct partnering with the healthcare system into other activities and capacities, such as being on a PFAC or in other roles in family leadership.
Can you talk more about that connection and the Family Leaders program that you have too? Because I think that is so important for family caregivers. So I'm just, if you could just talk a little bit more about that and like the resources that go along with it, because that's huge. Yeah.
Well, and in fact, anybody can be a part of our network and engage in anything that we do virtually, but the Florida Family Leader Network, and I'll add in their website link, is just what you would think it would be. It's those of us who either in a volunteer or paid situations work at more of a clinical or systems level on family leadership, but our focus is on pediatrics, children and youth, and into young adulthood in transition. We have a lot of conversations around healthcare transition for our young people as they move into adult services. But we are trying to build that pipeline and provide services and supports and networking for family leaders to learn and grow and bring new family leaders in, as well as the champions on the professional side who endorse and engage in those family professional relationships and connection points at direct care as well as systems level. And we have an annual summit that you're welcome to come. You'll have to pay to come, but it's going to be in January. It'll be our 6th summit. And we are, interestingly, going to be, our theme is focused on the value of family leadership, which is going to be mimicked a bit, just a little bit in a couple of hours with you all in the presentation you've got coming up later today, Lindsay.
Oh yes, yeah.
So there's some connection point in what our theme is going to be, but we also have virtual webinars, and we've got one coming up on the legal implications for young people as they move into what we call age of majority, age 18, and all of what that means in the changes for families in family caregiving. Dramatically changes with that magic age of 18. Those teenage years we were talking about, right? So so I'll put that in. If you're interested in learning more, you can go to our website, and then there's a little sign up form if you want to get on the mailing list.
Awesome. Thanks, Linda. I'm also curious, so because I know that as a family caregiver, you need support and resources. So how can certain maybe community-based resources be utilized to better assist family caregivers within their roles? I think you had mentioned a few that your network kind of provides or talks about. So curious if you had other thoughts on that.
Well, there is really a lot out there actually, but for families who they have a child who is born with a congenital situation, or there's something that develops, you know, in their early years and childhood years, or an acquired situation, it's a little different in where some of the supports can be found, but then there's a lot of overlaps with the adult community and adult caregiving side, with those of us who might be caring for a spouse or a parent or whatever. And it's a lonely life. We hear a lot about that, that we feel like we're alone, and caregivers, you know, have that sense of that, but there actually are a lot of connection points and more all the time as social media just continues to build ways that we can connect. But at a community level and some other organizations that some of you all might not be aware of, but every state has a family to family health information center. And that is always a great start point for our providers to help families connect to as they receive a medical diagnosis. And that's they are at the state level, or they may have regional office. Each state is a little different in how that plays out. And the national hub for all of those F2Fs, we call them family to family health information centers, is Family Voices National. And that is another great national organization to connect families to.
Absolutely.
There's other kinds of caregiving, and I'm just going to look and make sure I'm going to pull some of the names that I wanted to be sure. There is, it's actually interesting, but the AAP, American Academy of Pediatrics, has a whole section for families. And there is information for those families that do have a child with a disability or special health care need. And so you have to, you know, the AAP's website is huge, but they are now also the primary center for what's called the National Center for Systems of Care. And we have that National Center just came into being in July, and they are looking at kind of a consolidated and full systems, cross systems wide ways of having improvement on systems of care for children and youth with special health care needs. And the AAP is the holder of that brand new grant for that new center that they are setting up. So that's another place that families will be able to go to for some information, but so can providers, because it is, there's two sides to this coin, and that is that providers can do much to support the family caregivers. And that is the other place that I always say is talk to your providers. That's your start point for your shared plan of care. And then from that plan of care, figuring out what are the other supports in your community that you need, and what are some other groups that you can connect with that help you as a family caregiver. Whether you need that emotional support, or whether you want to engage in some activity of advocacy, there's lots of places to connect into with so many different disease and condition specific groups. That's for all of us who have that kind of a diagnosis that you can plug into. Down syndrome they've got a huge network. And then there's some global groups like ARC. They are cross disability for those with intellectual disability and autism, and they are a great support group all the way down to the local level as well.
Wow. So
the other is, when you have a young person with an identified diagnosis, many times it's not just the healthcare issues, but it's that whole child issues, because they are intertwined. And so the social emotional support needs of that child, the educational support needs of that child, the recreational opportunities for your child, all
Yeah.
of it is all intertwined, and it
Mhm.
becomes a big caregiving activity, because for us, and still for so many families, there is the advocacy to say, hey, my child should be included in all the recreational opportunities of our community, and we need to figure out ways and collaborate to make that happen.
Mhm.
My child has the right to go to the faith-based activities of our family faith choice, and so we need to figure out ways to make that happen.
Right.
And so there's this intertwining of all of this with health, the health being
Yeah.
at the base of it all, so
Yeah.
that they're safe and healthy as they are a part of full community and
Right.
grow up.
Yeah, that's so important. And Naomi has
Parent
also,
USA, yeah, thank you,
yeah.
Naomi. That was another group. And I will mention one other thing too, is that on the provider side, to help families in connecting.
Mhm.
Many of our families have no idea that palliative care services can be brought to bear that are appropriate in some situations, and that our families and our little ones will thrive if
Mhm.
palliative care is brought around to support them in the journey when it's needed.
Mhm.
And so many providers, they don't go there with families, and they should. And
Mm.
yeah, I'm preaching on this one because
Yeah,
it's a big,
Naomi's.
I
Yeah.
know. And my family would have so greatly benefited from it. When I had a son in the NICU for months, and then kept returning to the hospital and the PICU for months at a time or weeks at a time. And he was struggling
Mhm.
to live, and we were struggling right along with him to make sure that he had the best quality of life possible. And
Mhm.
that's what palliative care brings to the table. So,
Mhm.
ooh, that's a big, I'm starting to get a little verklempt
Yeah.
thinking about back in the day.
I know, I'm sure it can bring up a lot too. And somebody had texted, I think it was just a direct one to me, but about the like mental health aspect of being
Yes.
a family caregiver. And Sal put in there that it can be a lonely journey too. So I think just sharing these resources and the opportunities to connect and have someone who's in a similar situation to you, or yeah, just that support, I think could go a long way.
When you look up about family caregiving and start Googling around and reading, it's the same. There is no magic bullet. There's no perfect situation that says, well, if you just do these things, your family caregiving life the burden will be a little less. And I say burden, not that my children are burdens, but the burden of the systems that we
Yeah.
are having to engage and navigate through.
Mhm.
That's where the burden lies.
Yeah.
And they need to recognize our family is not a burden. Our burden is trying to make it through all of this navigation,
Yeah.
and keep that quality of life intact, and that we have a thriving family.
Right.
But you're right, Sal. But you look at it and it's like, make sure you take care of yourself. If you don't take care of yourself, then your family is going to suffer. And sometimes that is really easier said than done.
Mhm.
Look for respite care, look for your support groups, get even therapy services if you need it, and you feel you are moving into the pocket of life that you realize you need true therapeutic supports.
Right.
There's signs that, hopefully there's others in your life that keep an eye out for you on that and say, I'm thinking you need a little more help than just talking to a friend.
Right.
But
Yeah.
there's a lot to it.
There is.
I'm going to have I'm sorry, Lindsay, I'm not even letting you ask your questions. I'm just going to
You're
go on
good.
for hours. But I just want to also say that goes along with this. My family, my children, they are not burdens. And I just cringed when I heard that word being used as a label about families and
Mhm.
about the loved ones with the disability and the complex care needs.
Mhm.
My children are joys.
Mhm.
And I couldn't have been more happy to be a parent and to have the 2 children that I was blessed with, because we had such a happy family. And even in the midst of the most trying times, we found reasons to laugh, we found reasons to love each other even all the more strongly, and just joy in every step of the journey as much as we could. And not to say that there weren't very challenging moments, but to realize we need to keep seeking those joys of life and not let this and the world try to take that away just because somebody has a disability.
Mhm.
So that framing is so important. You're exactly right, Naomi, and it helps keep our eyes on the prize of we have blessed people who are in our lives.
Yeah.
And I would have never met any of you all if it hadn't been for Emily and Max Starnes. I wouldn't be in this world. So I've met so many wonderful, wonderful people because my 2 children brought me into this world of caregiving. So I think that's another gratitude moment for all of us right here, right now.
Yeah. Yeah. Absolutely. I think, yeah, very well said. Especially, yeah, your family's not the burden. It's these systems that you have to navigate. And I see a lot of 100% agreement with you in the chat. But speaking of the systems,
God.
I feel like this is where we all want to talk about too is, what are some strategies or things that work for you as, especially in pediatric caregiving as a family caregiver that work to communicate effectively and collaborate effectively between you as a family caregiver and healthcare staff, maybe even what hasn't worked in the past as well. So what works and what doesn't?
Okay. Well, we got our feet wet with Emily, but by the time her little brother came along, we really, my husband and I were we worked hand in hand, and I also happen to be a little type A, which helped me, but we became much more comfortable with each and every step in the journey and asking questions and saying we need more help, or saying we need to get a second opinion, or find a collaborative situation because this isn't working for us, or we're not sure it's the right route for our child. So we became more and more confident and realizing providers and all the rest of the professionals out there are human beings first. They will make mistakes, and boy, howdy did they. And that we have the right to question and to give pushback in a way that keeps them working with us. Because as soon as you go to confrontation and conflict, that's not going to serve anybody well. And so, I try really hard not to couch all of what we went through as it was battling and fighting and all the kind of the war words that get used. I know that that's how it feels sometimes. And I know that you get geared up for those kinds of things. But as much as possible, we tried to keep it open communication, collaborative communication, and finding ways to say we need to come up with solutions and that are going to work for all of us, and especially so that our child can thrive. So it's trying to another reframing so that you're not feeling like every time I go to an appointment or whatever kind of care plan situation that it's not that we're doing this together and collaboratively, and that I'm not having to fight for something.
Right.
I think that helps the mindset for everybody.
Yeah.
And, communication wise, just from a practical sense, I figured out early on, I was going to have to be very organized and have back then, you know, this was, my kids were born before Google was around.
Mhm.
That's how old I am. That's how old they are. But there were enough tools out there that for me to keep things up electronically as well as on hard copy, but just a lot of the record keeping. And I found it very helpful that every single appointment, every single doctor, we took in our consistent memo that gave the most current information and the reminders of this is my child and this is what they're doing in school, by the way, or they just got an award, or we just went on a great family vacation, so that they saw my child as a whole and active little person in the community, and not just focusing on a trait or focusing on a GI issue, but there's this whole person behind why who that they're taking care of. And I
Mhm.
found that very helpful. And it helped my kids too, because it gave them opportunity to start learning about talking to their doctor for themselves.
Yeah.
And it started building those building blocks to when they were going to transition and take over their own health care.
Right.
And so that giving those opportunities for them to learn along with me. Same with IEP meetings. My daughter Emily said, yes, that's another great and fertile learning opportunity for kids to be involved. So anyway.
Wow. Yeah,
That
I remember. Yeah.
organization, keeping
Mhm.
up with the paperwork, now the electronic health records. It's you know, utilizing those electronic health records and teaching your kids how to use them as they grow up to the best of their ability.
Mhm.
That helps tremendously, and making sure that they were accurate. When you go from one to another, you'll start finding out, oh, there's some goofs, and or they don't have all the information. So making sure you're doing consistent check-ins to make
Yeah.
sure everything is actually there and correct.
Yeah. Yeah. My mom had myself and my sister before Google as well. And I'm pretty sure she had every nursing book that you could think of. And she read through, she basically was a nurse.
Self-taught.
Yeah, a
Well,
self-taught
so
nurse.
was I. We were not allowed to bring our son home because he came home on a ventilator, and we had a NICU in our nursery
Right,
and
right.
before our nursing care. But we were not allowed to bring him home until we could pass all of the training so that we could take care of him if a nurse missed duty. And that happened a lot. We had so many missed shifts. And so I became, when my children were born, not only did I become a caregiver, I became a care coordinator. I
Mhm.
became a sort of kind of trained nurse
Yeah, yeah.
you know, and then I became a trainer, a management trainer, because we had over 300 nurses come through our home over the years of home
Oh,
care.
yeah,
And
yeah.
so I was doing training and development to make sure they cared for my son in the way that he had prescribed care. So it was, yeah,
Yeah.
a lot of hats.
Yeah, a lot of hats. A lot of hats.
Okay, so can we talk about that?
This is
Milestone app. The CDC has a lot of information. And I will say that milestone app is wonderful, except if your child is missing so many milestones. I've had a lot of families tell me it's traumatizing to think, okay, there's another one they didn't, or, so just keep that in mind as families are utilizing those milestone milestone information, is that can be a hurtful thing.
Mhm.
It's so Naomi. I see
Yeah,
your hand.
I think she had a different question in there. So go ahead.
It was, thank you. Yeah, it is. I would say thank you for everything that you're saying, Linda, off screen here, but I'm like, yes, 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 preach it.
We are cut of the same cloth, my dear.
Yes. I 100%, well, I agree with, depending on how your child is developing, the CDC Milestone app will be very helpful for you if your child is not extremely complex. If with the complex child, those are traumatizing, as well as the ages and stages, because you're acknowledging or having to say all the things repeatedly of what your child, the milestones that your child is not meeting, and there's no space or room given to say what they are doing. So would love, as you are doing the work that you're doing in the spaces that you're in, and for everyone else in the room, if you're in these spaces where you're able to put those plugs in, you know, can we create a space of being able to say what our loved one is doing, and not just solely, you know, from a deficit standpoint?
Yes.
That's that soapbox. I'll put that there.
Yeah, thank you. And that's exactly, that's what I was saying. That's why I put that information about, here's this wonderful thing that's happening with my child in school, or, you know, Emily was in Brownies and Girl Scouts, all that kind of stuff, because I wanted them to see those positives and here's what they are doing. And for us, any little moment of a new skill attained, whatever it was so meaningful. It would, that, you know, that to have providers know and appreciate that, but have the rest of the world celebrate that with us too. I mean, my son was 4.5 before he was able to walk independently and without a helmet and his little walker. But when he finally started to actually be able to take those first steps with much assistance, it was a joy and celebration. And, you know, that's what some of the unseen things that the rest of the world is not, who don't have loved ones with disability, and especially children, they just see it as, oh, that's kind of sad. Isn't that so sad? Still, people today say, oh, I'm so sorry you had to live life with a trach. He's not. He's great. He's doing wonderful. And so the assumption of quality of life that the world has about our children, that's another one of those areas that we just have to keep reminding people that it's not a sadness and it's not a pity party. He's here. He didn't die. We were told, put a do not resuscitate order. He will never make it. He will never know the world around him. He will never walk, talk, you know, have any quality of life. And, you know, we said, no, we're going to, that God and Mac are going to work that out. Well, they've been working it out for 28.5 years.
That's so encouraging to hear and to share. And part of that puts the burden on the families to put it back to the providers and those that we encounter, which is important. And I think sometimes not everybody knows how to do that, or you know, you hear from professionals all that, and not just medical, but can be educational or therapy and all of that, all the things that your child won't do, or your loved one, if they've had a stroke, you know, all the things that they won't do, and you forget or may not know how to be like, no, there's more. So so thank you for sharing that and encouraging us as caregivers to share who our loved one is. The part about, can we talk about this for a moment, was about the sustainability and the reality of family caregiving, because we are the default. So as you're talking about you not only becoming a parental caregiver, but you became an unlicensed nurse, basically. You didn't go through nursing school, no, but you're doing all the things, you're doing all the skilled caregiving, right? And that's where our nation is now, in a point of where we have the direct support shortage, and we have a shortage with nursing, and the default is coming to either the parent or family caregiver, and it's like, oh, well, they'll do it. And it's,
well, so now
it's not sustainable.
It's not. So now I will tell you, literally, one of my good collegial friends is a guy named Dr. Jeff Brosco. And Dr. Brosco is now at the federal level. He is the division lead for children and youth with special healthcare needs at the U.S. Department of Health and Human Services. And he got in touch with me and said, you know, we haven't talked in a while. Let's have a little visit. And that was this morning. And he said, I want to tell you one of the things that I'm hoping that you can start advancing this conversation into, because I really, what the research is showing is that if families are the caregivers and they can afford to be there and want to be there, the children thrive the best. And so we are very interested and paid family caregiving. And all the discussion that has really been bubbling, especially since COVID on, that families deserve to have that payment so that it is sustainable. I was not employable. I was at the hospital or a doctor's office all the time for years. So I couldn't have been employed. And I just had, thank goodness, the blessing of financial resources that my husband could bring in that allowed me to be home. But they deserve that payment. And Unseen, I just put it in the chat, that movie you can rent for 72 hours for $10. But go to that website. They've got some great resources there, even if you choose not to watch the movie, about pediatric family caregivers for children. But it's a great film documentary, as well as the resources that are attached to it at that website. But that's one of the premises, is we have got to get legislation moved forward, and our Medicaid services to start to pony up as well, and realize that we need to have families receiving the support so they can take care of their children and not go broke while they do it.
Wow. Thank you for sharing that in there, Linda. We'll share that away. I'm gonna pass it on to my parents, but yeah.
Yeah. It just is so uncanny that I had that conversation that was just one of those serendipity, let's have a little chat. And this was the very topic that he wanted to talk to me about, and say, can you, in my circles that I'm involved in, just start raising this issue. And we've got to figure out ways for some of our organizations to start advocating as well for that kind of legislation at the state and federal level.
Yeah, I had no idea that was going on. Thank you for sharing. Yeah. I see your daughter Emily has her hand raised.
Oh,
if I may jump in for that.
Yes, please.
One of the things that I was going to type in the chat, but I feel like it's better left said verbally, is that independent living centers like the Independent Living Resource Center, or ILRC, has a core service being systems change. I saw that was in the chat earlier, and one of the systems change topics that's so heavily valued, not just at ILRC, but across the board, is home and community-based services, caregiver funding, public health, which is my position, even though it is a grant-funded position from the Administration for Community Living. I have a funny feeling, knock on wood, that I will be around here longer than the 2 years that ends next October for the grant. Hoping and praying that's the case. But all that to say, while our system change advocates across all the CILs, or Centers for Independent Living in the country, of which there are 400 something, I think, while we can't lobby for a specific bill like Senate Bill 557, just put a random number out of a hat, we can advocate on the state, local, and federal levels for systems change policies to be implemented. One of the a specific example that we had at ILRC is we have a rapid response committee bringing together staff and community members at ILRC to focus on systems change topics. And we actually had several conversations with, I think the people in LA and across California might be familiar with this person, Salud Carbajal, our representative, one of the representatives that serves the state of California in Washington, DC. So yes, it does take a bit of teamwork and a bit of creative education that can't be considered lobbying, because we aren't allowed to do that because of federal laws, and just having people with disabilities be self-determined and make their own decisions as well for that. And we also are a nonpartisan organization, but there are creative avenues. So I would suggest, if you aren't familiar with your independent living center in your community, please definitely reach out to them. And if you'd like some more information from somebody that has lived experience with disabilities and is serving in a healthcare related capacity at a CIL, just for my own firsthand experience, which might not be across the board similar, then I'd be happy to put my information in the chat for you all.
Awesome.
And I will yield back my time to Lindsay and my mom. Thank you all.
No, thank you so much, Emily, for sharing that information and being open to, talking more with folks who would like to connect. Really appreciate that. So much to learn here with all of you today. And I know we have a few minutes left, but Linda, just wanted to see if you had just any last minute things to say. There's so much going on in the chat that I'll have to read through later. So
Same here. I mean, I've not been able, part of it's because I was talking too much probably.
no,
But
no, Naomi, don't apologize. I'll save the chat so we can share it out with those who would like to.
a great
Go
great
ahead.
chat, and I'm gonna be wanting to read it too. But I did just put something in there last week. There was a kind of a different take on this caregiving conversation by an organization that I just posted in there. And one of my colleague friends, Molly Marksky, was on the panel. She's the program director for the National Genetics Education and Family Support Center, as well as the executive director of Caring Bridge. So you might want to go when they post the archive. It was a nice conversation, and that's an interesting organization that hosted that presentation. So I was pleased to know about them as an organization. But I think the role of caregiving is one that people don't think about as this high level of importance, or that it is the meaningfulness of it enough, and realizing it is a gift sometimes that we are given, even to the point of caregiving for someone who is at their point of leaving this world, and that you can be there and providing that service. And so I just hope that everybody who is a caregiver sees themselves as such an important part of their family and their community. And it is one of the most important gifts that we can give of ourselves, is to be a caregiver.
Absolutely. Well said. Thank you so much, Linda. I appreciate your time today, and Emily, your daughter, joining us, and everyone who participated in the conversation and in the chat. I'm going to put the link to the PFAnetwork pediatric community on the forum. If there was a lot shared here today, so we'll make sure a lot of these resources get in there. But if you would like to post a conversation or a question or anything like that, we welcome you to do that. And if there's interest, we can also start, a general family caregiving community in there as well. So yeah, lots to share. And I am going to save the chat now so we can get that to all of you, so you can take a look at everything that was in there today.
We were a chatty bunch today, right?
It. No, I'm so glad that I got to facilitate this this coffee chat with all of you, from my family's personal experience, and just being able to connect with all of you and bring you together. This was really great. So I appreciate all the chats, all the questions, all the conversations, and appreciate you too, Linda. So thank you.
Well, thank you. And please let Trish know, I'm sorry she didn't get to make it, but I hope that there'll be an opportunity for her to just have her own coffee chat with us all sometime.
I think that will definitely be, we'll have time for that for sure.
Cool. Okay.
All right.
Well, happy holidays, everybody. I'll see some of you in a couple of hours.
Yeah, we'll see some of you on the next workshop at 11. Yeah.
Yes.
Yeah.
Naomi's leaving now. Yep.
Yep. Have a great weekend.
Talk to
All
you
right.
later.
Take care. Bye, everybody.
Bye-bye.
Hello?